Welcome to Healthy Focus, the Duke Raleigh Hospital Community Education Series.
Please join me in welcoming Dr. Charles Woodard.
I want to extend my gratitude to Duke Raleigh and their marketing team for putting together really an excellent series for you guys. I think this is wonderful. And all of the medical centers that I've attended, I've never seen anything done on such a regular basis that really is intended to be community outreach and really help educate folks in a more, really this should be an informal setting, something comfortable where you feel like you can ask some questions to the doctor and try to clarify some things and maybe even some myths that we see in society related to many different medical issues. I also want to extend my thanks to all of you. It's not exactly warm and sunny outside, and so I really appreciate you taking the time to come out to listen to this talk, and I look forward to speaking with you in a more intimate setting and hopefully answer some of the questions regarding the topic. This is a little bit of a different kind of a spin on what we would consider to be a healthy focus, but my argument would be that when you look good or when you think you look good, you actually feel good about yourself. So there's something to be said about your own personal health and how you feel about yourself when you look at yourself in the mirror and how you perceive yourself and how you feel that others perceive you. So I think when you think of it in that context and remove the overdone Hollywood appearance that we often see in magazines and anorexic appearing individuals in their 20s, that's really not the focus of the talk. This is how to help you feel like you can be refreshed and rejuvenated. So I'll go through a couple of things in this talk to go over that. And at the end of the talk, we'll have time for questions, as Mandy had mentioned. We'll also do actually a live injection so that you can kind of see what the typical patient might experience during that. I have no relevant disclosures. There's not any product that I'm going to discuss today that I receive any honorarium for. I've got no relationship with any of these companies whatsoever. I don't have any particular interest in any specific products. I tend to use all of the different things and individualize them in my treatment for different patients. So let's take a step back from procedural type stuff and just talk about beauty in general. What actually defines beauty? And when you look through that big dictionary, Webster's Dictionary, the definition of beauty is a combination of qualities such as shape, color, or form that please the aesthetic senses, especially the sight. Makes sense? And a combination of qualities that pleases the intellect or moral sense. I think that's a pretty good definition. Let's take a look at what some of the famous people in history have said about beauty, because it's really an interesting topic when you start reading about it. Plato, we've all heard of Plato, his famous quote on beauty, "By means of beauty, all beautiful things become beautiful." I can buy into that. Aristotle, "A concept of beauty occurs when all parts work together in harmony so that no one part draws unjust attention to itself." Confucius, "Everything has beauty, but not everyone sees it." In Edgar Allan Poe, there is no exquisite beauty without some strangeness in the proportion. All of these things are true. I tend to take a more simplistic approach, perhaps. And it is in line with this article that was written in the National Geographic a couple of years ago on the enigma of beauty. A great article if you get an opportunity to read it. And there was an individual in the aesthetic industry, a fairly famous individual who just said simply, "I know it when I see it." And I think that we can all relate to that because it really is an individualized thing. Beauty is not something that there's one simple ideal and everyone must meet that ideal. It is different for each individual. When you type in facial beauty into the internet and Google, these are the images that pop up. But I would argue there are certainly cultural differences in beauty. That is a little bit of ethnocentricity that we're seeing here. In other words, our own, or Google's own view of what they think beauty might be when somebody's looking for it on the internet. But there are many different cultures that would argue that this is not in fact true. So if you take a look at some of these individuals and their cultures, which have existed for many, many, many hundreds, if not thousands of years, these are all beautiful individuals in their culture. But if you saw any of these folks walking down the street, obviously they would catch your attention and you'd probably remember what they look like for the rest of the day, week, month, or even year. So just a little history. I just find this stuff really fascinating, how different cultures perceive beauty. In the Padawan women in Southeast Asia are considered giraffe women, and as young children, they start by placing these rings on their neck where they actually stretch the neck out and push the collarbone and the shoulder down while they're developing, so that when they take these rings off, their neck is actually that long, and that is a sign of beauty. The number of rings that they can fit in there is a mark of how beautiful they are within their own society. This is something called a lip plate, and in many of the, and it is hard to look at. I see some of you wincing as you look at this and can imagine the potential pain that this person has put themselves through, and it's all because this is the expectation within the society. So when these women are around the men in their culture, they're expected at all times to wear this lip plate. And because it's stretched out so far, that would never, if you were to remove that plate, that would never heal itself. But it doesn't matter to these women, because the larger the plate is, the more beautiful, the more desirable that woman is within that culture. Again, imagine this walking down the street in today's society here. Just a very different perception of what beauty is. And this is a concept of scarification in Papua New Guinea that occurs. And it's an initiation process. So this is a rite of passage for men within the culture in Papua New Guinea. And they tend to try to take on the resemblance of a crocodile, and it's their passage from a boy to a man. So it's a mark of achievement, a beautiful mark of achievement within their society. Then when you take a look at our own history and look at some of the women that are shooting up here as you go through the Victorian age, and even just as recent as 50 or so years ago, you can see some very significant differences in what we hear even in the United States, England, Great Britain, that sort of area, have perceived as being beautiful. And I would argue that some of the women on the top row there perhaps aren't going to be found on the cover of Vogue or Glamour magazine in today's society. Yet at one time that was the mark of beauty. So it's really interesting how things change. So I would argue, in summary, that beauty is difficult to define, ever-changing, and remains in the eye of the beholder. So with that, you're chasing this ever-changing mark that's different for each individual. How in the world can you have a successful outcome if you're trying to treat a patient who is looking to improve upon perhaps their appearance? And so this is where every surgeon will take a different take on how they approach different things. And this is my own personal take on how we would approach treatment for the aging face. And it's really these four pillars that I like to focus on to, a little bit of technical difficulty here, just make sure we got good connection. It's really to restore, refresh, rejuvenate, and provide balance. And I feel like if I can achieve these four goals, I'm able to come to an understanding with the patient on what the expected outcome will be, and I find that overwhelmingly that outcome is universally successful. So let's take a look at what happens when we age. This is a split photograph of a young woman and then her grandmother. And it shows really some very interesting things that I want to point out that as we age. So, and everything's kind of marked out over here. This is all sort of, some of this is a little bit of medical speak, but just to kind of break it down, we see that the brow tends to descend a little bit. You lose fat or volume here in the orbit between the eyelid and the skull, so it almost skeletonizes the eye. Medially here, which is closer to the nose, you get a pooch of fat that sticks out, and that herniation is pretty classic as we age. The lower lid tends to start to droop down a little bit, and you develop these bags under the eye. You have a loss of fat and volume in the mid-face area here, and that loss of fat and volume causes this entire chunk of tissue here to descend in a medial fashion, which causes deepening of this fold. The lip tends to thin out. You have a deepening of a fold of the lower lip, and then jowling tends to occur as we have loss of volume and sagging of tissue. So this is kind of what we see in the progress or the process of aging. How are we going to fix all of this? Well, in this particular individual who's split from her pre- and post-op views, you can see that with repositioning of the brow, removal of some excess skin of the upper lid, tightening the lower lid, creating a smooth transition here in the mid-face with a mid-face and a lower facelift that also comes down and addresses the neck, that you can really see a significant difference in the aging process. You really have, I don't really like the term turn back the clock. I'm not a huge fan of that. Somebody who is 60 and comes in and says they want to look 20, I'm not their doctor for them. So I think the major assumption that I have is that you've selected the correct procedure for the correct patient. Correct's in quotes there because it's individualized for each patient. And this is where doctors lose and this is where patients lose. This is where you have an unhappy patient and an unhappy doctor and a bad outcome. It's because you haven't educated the patient about what you think there is that needs to be done. And if you have tried to educate the patient, you haven't listened to the patient if they're unhappy. Because if they come in and you think you've done a good job and ultimately the outcome is less than favorable for the patient, then it doesn't really matter. You haven't done a good job. That truly is the problem. Now, this will be a memorable talk for at least the audiovisual. All right, so who's getting aesthetic surgery? The assumption is it's the millionaires living behind the big tall gates, getting all these things done, and that's not the case at all. Not the case, not even close. This slide is from the American Society for Aesthetic Plastic Surgery, and they are really the folks that gather the statistics on cosmetic surgery. You want to do something different?
I'm just going to switch this VGA, see if this VGA is complete.
Okay. So we'll talk about this slide for just a minute here. What it shows is that between 1997 and 2011, there's been an uptick in surgical procedures of approximately 700,000, almost a doubling in surgical procedures. In non-surgical cosmetic procedures, it's gone from around 700,000 or so up to 7.5 million. It's a pretty big jump in 14 years. So this has to do with a lot of different things, and we'll talk about it here shortly, but the main driving force is the societal perception of folks getting aesthetic procedures done has changed. It's understood now that it's almost an accepted societal norm, and because of that acceptance, folks aren't as, afraid's not the right word, but resistant to the idea of maybe doing something to improve upon their appearance. We have certainly seen that more in the non-surgical realm than we have in the surgical, but even, I would argue, over approximately a 10-year period, a doubling in surgeries across the United States. That's pretty significant. So these next couple slides, what they're going to essentially show is that the non-surgical procedures have increased quite significantly, but I'd say the surgical procedures have as well. What are the most common surgical procedures being performed? In women and in men, liposuction is very common. Breast augmentation in women is very common. In both men and women, blepharoplasty, which is eyelid surgery, is a very common surgery that's performed. And these are sort of the top 5 lists. Rhinoplasty in men is also a very popular procedure. And we've seen an uptick of approximately 100% in men in procedures from 1997 to 2011, and over 200% increase in women over that time period, with the overwhelming majority, about 90% of these procedures being performed on women. Now, what's driving the non-surgical procedures? Well, really, everybody's heard of Botox in the room. You know, it's heavily advertised. It was sort of the first non-surgical thing that physicians were doing for patients to help improve upon appearance, and it really had a remarkable outcome on aesthetics, because you can come in, get the procedure done, have zero downtime, and then a week later you have a benefit that lasts you for six plus months. Okay, so I was just talking about the common surgical procedures. This is, again, the top cosmetic surgeries for women and men. Women made up 90% of those procedures, a 200% increase for women. So the driving point here is that it has become a more accepted part of medical treatment for individuals. So where is most of this stuff being done? Well, I think it's quite interesting that if you look at the map, right where we are is the area where you're seeing the majority of aesthetic procedures done in the entire United States. So more than California, more than New York overall. Now, of course, that's a smaller geographic area, but again, think about the millions and millions of people packed into New York. So what's available here at Duke? Well, really the whole gamut of facial procedures. Some of the stuff I don't have here at Duke Raleigh, where I practice probably, I'd say about 10 to 15% of the time, but I'm actually looking to increase my time out here at Duke Raleigh. Most of my practice time is at the Duke Aesthetic Center, which is located in Durham, but I do see patients here and treat aesthetic patients here at Duke Raleigh as well. I just don't have access to the laser, chemical peels, or dermabrasion here at Duke Raleigh. Those are all done at the Aesthetic Center in Durham. But Botox and Dysport, those are the neuromodulators, and we're going to talk more about this stuff. We're going to go through each of these and delve into them and just figure out what they are, because I want to make sure everybody's educated on the different things that are available and what each of these different sort of treatments mean and how long the downtime is and all that kind of stuff. And then surgically, these are all the surgical procedures I perform. I'll make a special note here of rhinoplasty, which is changes in the shape of the nose. Because this is a talk that's focused on aging face and management of the aging face, really the nose doesn't fall into that category too much. So I'm not going to focus on rhinoplasty in this talk. It is a large part of what I do from an aesthetic standpoint. And to take a step back, I'm a facial plastic surgeon, so my focus throughout all of my training has been on the face. I know that Mandy introduced me as having training and background in otolaryngology. That's just a fancy word for ENT. But all of my training, even as a resident, we trained in facial plastic, aesthetic, and reconstructive surgery. And there are folks that come out of their residency training and actually do facial aesthetics because it's 5 years that you're focusing on this stuff. But I was so interested in and wanted to be involved in an academic setting that I spent an additional year at Stanford doing some additional training specifically in facial plastic and reconstructive surgery. So won't talk about rhinoplasty today. If any of you are interested in that, I'm more than happy to talk to you on an individual basis about that. So let's go through some of the non-surgical things. Botox, I'll go through the history of it because I really think it's quite interesting. But in 2002, it was sort of the first approved injectable thing that you could do for aesthetics. Before that, it was being used off-label and at great success by a bunch of different dermatologists. But once it got approved in 2002, the numbers just exploded. And you saw the difference. Recall back to that slide. In 1997, there were about 700,000 or so non-surgical procedures, and then you fast forward to 2011, and there's 7 million. Yeah, this has a lot to do with that. This one product has a lot to do. Not to be outdone, you know, a different flavor, same exact medication, and this is actually what I'm going to be injecting this evening because it's happened to be what I had up at the office at the time. Dysport is another form of Botox. Really, you're going to hear different docs, particularly ones that are on the advisory boards of these different companies, tell you that there's a whole lot of difference between these products. I'm here to tell you that there really isn't. Patients individually may experience different results. Like, in other words, some folks, maybe even in the room here, have had Botox or Dysport, and they prefer one over the other. A lot of that actually has to do with who's injecting the product, where it's been injected on you, and whether or not the person who's mixing the product is mixing it correctly. Because there has a tendency in some people to over-dilute product because then you spread it out and you have more available and more money. You can see that slippery slope there. So you want to make sure when you're going somewhere to have this done that you trust the individual that's doing the injection. So a little history, botulism discovered in the late 1800s. In the 50s, they were doing some studies and found out, hey, we can make the muscles relax on command, and we can target specific muscles with this. So an ophthalmologist, an eye doc in the 60s said, well, you know, we've got this problem with kids with strabismus. The eyes keep turning in, overactivity in muscles. Maybe if we inject a little in the muscle, we can relax it and get the eyes back in appropriate position. So they worked on some studies with that, and finally in the late 70s received permission to do so. But notice just kind of secondarily that they were having some other improvements when they were using this medication. Facial spasms, neck and shoulder spasms were getting better, headaches were getting better. And they were saying, well, the only thing we're doing different is injecting Botox in these muscles. Maybe there's something here. So Gene Carruthers, Canadian ophthalmologist, really wrote an earth-shattering paper as far as finances and aesthetics and all that are concerned in the early 90s, showing that she noticed in her strabismus patients that the crow's feet, the wrinkles around the eye, were getting a lot softer and the eyes were opening up. And in particular, what she was seeing was the strabismus patients, because again, you're injecting just one side to get the eye to function appropriately, so the other side's all wrinkly. The patients were coming in, their eyes were in perfect position, but they were saying, Doc, you know, I love the fact that I don't have all these wrinkles on the side of my face. Can you inject whatever it was you had there on the other side? And people were just coming in droves to have this done, so she wrote a paper on it, and dermatologists read this paper, and by the late 90s, Botox was just out of control in terms of how many people were using it, that the country's supply temporarily ran out. They couldn't make it fast enough for folks. Okay, in 2002 is when we got the official approval from the FDA to say, go ahead, you can use Botox as an indication for treating glabellar frown lines, or what the heck are those? Those are the vertical 11s that you get between the eyes. So really that's the only technically approved use for Botox. So if it's injected anywhere else on the face, it's, quote, off-label, but it's been used safely in millions and millions and millions of people. So it's pretty much accepted. It's just not an FDA-approved use of it. And as I've said several times now, it's the most commonly performed cosmetic procedure in the world. How does it work? So this is kind of a busy slide, but essentially, if you think of your nerves as kind of like highways, and it's sending packages of information down that highway and the nerve tells the muscle what to do, those packages of information, or neurotransmitters, are blocked by this botulinum toxin. So instead of the nerve telling the muscle to fire and work, it can't send that information to the muscle, and it just doesn't do anything. The beauty of this Botox, if it's injected in the right concentration, is that it stays in that muscle, and that muscle just doesn't have the function, or it has much less function than it normally would. And when it has less function, it doesn't pull on the skin as much as it normally would. And when it doesn't pull on the skin, you lose the wrinkle. So it's this stepwise progression in the treatment with this particular medication. So just another slide showing that if the botulinum toxin is introduced, that this vesicle with all these little green dots in it can't release the information to tell the muscle that it needs to fire, so it doesn't fire. But this is something that just kind of fatigues over time, so this is not a permanent treatment. So where's Botox commonly used? Well, it's really, in most individuals, used in primarily the upper third of the face, so around the eyes, the forehead, the crow's feet, the wrinkles between the eyes, and I'll show you some pictures of this. That's the focus of where most people use Botox. It just kind of rejuvenates the upper face. For folks that come in and say, I'm so tired of people telling me I look tired when I don't feel tired, what can I do? Bam, you can do this. This is something that'll get it taken care of for you, and in 5 to 7 days, you'll have the result that you want, because it has a function of taking away all the chronic tightness of those muscles to relax everything, smooth everything out for you. But I will tell you that now it's being used in other areas of the face for people who get what we call the bunny lines or wrinkles around their nose that don't like those, for people who get dimpling around the chin and don't like that. We're starting to be able to titrate the doses in these specific areas to achieve the same effect that you're getting in the upper face, kind of softening the appearance of everything. So this is a typical patient. They're furrowing their brow in the top picture. In the bottom picture, they're attempting to furrow their brow. And I'll point out a couple of things here. So one of the things that the Botox, in addition to softening this, and I say Botox, I mean neuromodulator, the Dysport does the same thing, softens this area right here between the brows. It also, when it's injected appropriately in the forehead, repositions the brow. It sculpts the brow. And I love the injections over here along the lateral side of the eye. Not only do they get rid of the crow's feet, but a small little injection right here is a home run. Lifts the tail of the brow, takes care of some of the excess skin, because most of the hooding of the skin of the lid is lateral. It sets out right where this dot is right here, and then takes care of the crow's feet. So it really is a home run kind of an injection in those areas. Not limited to women. In men as well, you can get a nice sculpting of the brow. It has to be injected differently in men, because you don't want to give a male a feminine appearance, really elevate their brows or give them a concerned look. And while Botox is fairly simple to inject and well tolerated by patients, there are complications associated with it, and most of them are driven by the injector themselves. And one of the real problems is that you can drop the eyelid down and get something that's called ptosis. So in this individual here, this is somebody who's had Botox. Got it off the internet from blepharospasm.org, but essentially after her Botox treatment, somebody injected too low on the too low on the forehead, and the Botox trickled down into her upper eyelid and dropped her eyelid down. So this is how much she can open the eye on that side, and that stinks. You know, that's a problem. And you can't go in and suck out the Botox. It doesn't work that way. There are a couple of different eye drops you can use to get the eye to open up a little bit more, but this is really a function of this Botox affecting another muscle. Botox doesn't care where it's injected. It has the same effect on all muscles, so you have to be careful of where you inject it. And in this case, it was poorly injected, and as a result, this patient is like this. Now, the good thing and bad thing about Botox is it doesn't last forever. So this patient's going to have this for about 4 to 6 months. It'll continue to get better, and as I said before, there are some special little eye drops you can use to get the eyelid to go up a little bit. But I mean, again, this is a cosmetic procedure. Do you think this patient wanted to look like this? This was not the intended outcome, and this is an unhappy patient. Poor technique, unhappy patient. So here's the quote money slide, because oftentimes you see advertisements for all this stuff and you're like, well, what the heck does this stuff cost? Is it $1 million? Is it $6? What does it cost? So these are average numbers. In general, a full treatment of the upper face, between the eyes, taking the wrinkles out of the forehead, getting around the crow's feet, lifting the tail of the brow up, around $500. If it's your first time, can't really tell you how long it's going to last because it's different for each individual, but usually I see folks up to it's about 6 months. They're usually coming in twice a year for this type of an injection. And you think to yourself, well, shoot, I don't want to do that. I don't want to have to come in twice a year. Well, twice a year is not that big of a deal, first off. And second off, there's not a great surgical treatment to do what Botox affects. It's really, for folks that are interested in surgery, Botox is kind of like the icing on the cake. It smooths everything out after surgery, but there's not a surgical procedure I can do to make the muscles of the forehead not move, unless we start cutting a lot of nerves, and that's not good because then everything starts to drop down. So this is really one of the only things you can do to get that nice effect of the upper face around the eyes, and the eyes are really what has it in a lot of individuals. Downtime, really none. You get a little risk of bruising, a little pinpoint bruise at the injection site. If you're on aspirin, blood thinners, anything like that, the risk of bruising is higher, but I still personally will inject because I don't think it's that big of a deal. It's not like we're doing a deep injection or anything. I'm talking about a small bruise. The only people that I don't do are pregnant women, breastfeeding women, and women with a neuromuscular disorder such as myasthenia gravis, multiple sclerosis, any kind of neuromuscular problems, because there's a theoretic chance that some of those things could get worse with injection. I'm going to get everything going here. I'm happy to answer questions while we do that. If I could get my volunteers to come up. So Patricia has kindly allowed me to point out some of the aging things that have occurred in her face, which I'm more than happy to do. But we have a beautiful volunteer, so it's easy to do. So again, as we age, she's actually got pretty good volume here, but as I touch and feel, there isn't much distance between the skin before I get to that bone there. So restoring volume in this area right here, you can see as I lift that area, she has a much more uniform appearance than if I let that tissue descend down. And so in her, it's not quite as noticeable, but what she has developed here is a deepening of this fold, and this is one of the areas that she had pointed out that she would like to have addressed, and it's the most common area that we actually inject filler material. Today I'll be injecting Restylane, and if you remember earlier in the talk, Restylane is one of the hyaluronic acids. So what our goal is here is to restore some volume in this area where she's had deepening in that fold, just to kind of soften that trough. And as you recall, the hyaluronic acid actually draws water to itself, so it'll give her some volume in that area. Now if we fill up this hole, you say, well, doc, get rid of the wrinkle altogether, or the fold, you give them a chipmunk appearance. You're starting to pull their whole mid-face out, or their whole lower face out, and that looks really bizarre. So that's not something that I would want to do. And so if a patient has an expectation that that's the outcome they're going to get from the injection, again, patient expectation, surgeon expectation doesn't meet, so we don't do a procedure. So that's what I noticed in the aging process. And then furrow your brow for me for a second, like you're, look at me for a second like this, like you're pensive about something. There you go. So she's got a little bit of what we call the vertical 11s. Hers aren't quite so deep. Furrow your brow again like that, like you're looking at something, or you're concentrating. These are where these lines are. I can see them up close probably a little more than you can see them on the screen. Squint like it's bright outside. Okay. And she's got a little bit of crow's feet that have developed here. And raise your eyebrow up. Not a whole lot of wrinkles across the forehead. So I think for demonstration purposes, we'll get her brow repositioned with a little with Dysport, which is the same as Botox. If she came into my office, I probably would say just wait a little while. I don't want you to spend the money, but since it's free here for her today, and give her a little touch-up, why not? Right?
Right.
Okay. So the things that I tell my patients to expect, and I've gotten consent from both of my volunteers already. I always get a consent and go over the risks and benefits. The risks are asymmetry, so one side looking a little bit different than the other side. And again, asymmetries exist in every individual. So if the patient goes home and says, well, there's 1 millimeter of difference here, I'm going to tell you that 1 millimeter of difference will exist. It's just, it's normal, so you can't be too critical of yourself. The other risks are nodules that are formed, and that's from inexperienced injectors injecting too superficially, but I do tell them that that is a risk. I've not had it happen to me, knock on wood. There is a risk of bruising. So if somebody has if somebody comes in and says, I want you to inject me for my big event tomorrow night, I tend to tell them, you got to acknowledge, you have to understand there's a risk of bruising. So if you're going to be in front of a lot of people and you get a little pencil eraser size bruise, that may be unacceptable to you, so maybe we should hold off and you should come back. And the other thing I tell people who come in for neuromodulators like Botox or Dysport is that Botox takes about 5 to 7 days to take effect. Dysport takes about 3 to 4 days to take effect. So if they're looking to do something and then 2 days later is why they were doing it and they want to have the result, it's not gonna, it takes some time to kick in. So I think that's pretty much it. We can get started. So I'm just cleaning you up with a little alcohol swab.
So you don't need the lidocaine for the Botox, only for the fillers?
That's correct. That's correct. I'll tell you before I stick you. Let's actually put a little towel around you. I don't want to drip anything on you. You excited?
I am.
We are.
Okay.
Yeah, it is.
All right, turn your head toward me. So the general area that I first go is, you get these bangs that really like to come in the way here. Just hold it back for me. There you go. Because I want everyone to be able to see. So I usually have patients furrow their brow. That's when you're trying to look at something or you're squinting at something. You can probably see on me, I've got these little lines here that have developed. And that just tells me the action of the muscle and where I want to focus the injection. Because again, as I said before, Botox really does not care where you inject it. It's going to have an effect on that area. So you want to make sure you get it in the correct area. All right, so you're going to feel a little stick here in just a second. A little poke. Good. And you may feel a little burning sensation, and that's called totally normal. Fantastic. And again, this is going to take a couple of days to take effect. All right, and so I'll just hold a little pressure there. How'd that feel? That one? You know, I will tell you that patients complain a little bit more about Botox and Dysport than they do about the fillers. So the fillers around the mouth tend to be a little more well tolerated. One of the reasons I think that is because the filler that I tend to inject has lidocaine actually mixed into it, and that's mixed by the actual company itself. And so the injection is a lot more comfortable.
And which one would that be?
Restylane. Restilane's what I tend to use. Again, I have no affiliation with any of the companies. I just like the feel of that particular product as I inject it, and it's all physician preference. And I get a result that I really like with it, but I will use other product as well. Okay, good. So the next treatment I do is around the eyes, and eyes are really sensitive in terms of getting bruises because you have to look out for these little veins. So I can see on her she's got this little patch of veins on the side of her eye here. I want to make sure that I don't hit any of those. A little stick right here. Good. Stick down here. And one right here. Good. You're doing great. Thanks so much. Appreciate you not wincing. Tolerated okay? All right, now I'm going to swing around to the other side, do the same thing. And I will tell you, of all the places I inject anything, this one little injection right here really makes a difference. Because for her, you can see she's got some excess skin of her upper eyelids right here. So if we put that injection in and lift, look at that lift on the tail of the brow there. Can you guys see the difference there? Yeah. As we zoom in, that's what she's going to get from the injection. So it'll look like she had a little skin removed from her eyelid. Her eye looks nice and refreshed. Her brow's up a little bit, gives her a little more of a regal look, and that's all from one little stick of this product. So it can affect a change. And the reason why I've got these ladies as volunteers is because they help run this Healthy Focus. So for those folks who come into these next Healthy Focus sessions, you can see the result. Stick right in here.
Come see my liposuction.
Yeah.
I don't know about that.
No problem using the same needle in each area, huh?
No, sir. No, sir. None at all. Good question. And then the last thing I'll do is the forehead. I'll just sprinkle a little. She didn't have much in the way of wrinkles across her forehead, but since we have a little extra here, we'll use it. I'm just going to stand up for this. Raise your eyebrows up for me. The key for this is not to inject too low. So you need to inject up high in order to prevent this product from sneaking down into that eyelid and causing that problem that you saw in that lady. Nobody wants that. You okay? And all right, and that's it. That's a treatment.
The Restylane is all over, and you have it. You just injected Restylane.
No,
everywhere?
no, ma'am. I've just injected Dysport everywhere. So this is like Botox.
This is like Botox.
This is like Botox. I'm getting ready to do the Restylane right now.
Okay, that's not good.
You feeling all right?
It's
Good.
watery eyes.
All right. I'm just going to wipe you down here. And again, this topical numbing medication isn't necessary. What I will tell patients when they have it is you can kind of see on her, it doesn't really show up as well in the picture, but her skin looks a little white where I had this stuff. That's from the topical medication that I put on there. It's got a little epinephrine in it, which causes the blood vessels to constrict. So that's totally normal and goes away in about a half an hour. Sure. There you go. All right, so that's that. Now let's open up the syringe of Restylane.
We're watching your foot.
We're watching.
I know.
You watching my feet?
No, they're watching my feet.
She getting excited?
Yes, I'm very excited.
She's like she's at Six Flags.
That's right. That's right. I'm doing my treadmill run while I'm waiting.
This would look beautiful tomorrow.
You come see me on Saturday.
All right.
That'll be the
Let's see here. I'm going to just inject a little bit of this. Let's see. Are we going to be able to see this at all? Can you zoom in on my needle or not really? Is that going to get too blurry? Yeah, I don't think you're going to appreciate what this stuff looks like. There's a little bit. Yeah, it's too hard to see. It's okay. It's basically like gel.
Looks like Vaseline.
It's actually more like, the best thing I can think of off the top of my head is like hair gel. It's
Oh,
basically
yeah.
the consistency of hair gel.
Yeah. So you can move it around.
You got it.
Yeah.
That's the key.
Yeah.
Therein lies the key. Okay. So in this area, right, you can see she's got a little bit of a wrinkle or a fold that's developed here, one that you can notice on the other side here, and then of course the folds up here. We're not making them disappear again, we're just softening those folds. So just a little stick underneath the skin, just a little injection. You doing okay? Feel free to ask questions, folks, if you have any.
I can't look what it does.
Is that what you also use to like plump up the lip?
It is, indeed. It's the only product that's approved by the FDA to inject into the lip
Oh, okay.
itself.
Okay.
That's why I like it, is because it's such a universal product. I don't have to get a whole bunch of different things. I can do everything I want with one thing.
Does it work pretty good on the lip? On
Oh
the upper
yeah,
lip?
yeah. On a deflated lip, it works. It works really nicely. The problem with the lips is that Hollywood got a hold of them and everybody got over injected, and so people get these duck-looking lips and cat lips, and there's so many lip deformities from all of this. It's unbelievable.
What's her name? What's the actress's name?
Angelina Jolie.
Angelina Jolie.
No.
No? Oh, that one. Oh,
Lisa Rinna.
Lisa. Yeah. Yeah.
Very good.
Yeah.
And you'll notice there's little pinpoint areas where you're seeing a little bit of bleeding. That's because a needle went into the skin. That's totally normal. It's not anything that would be unexpected. So when you leave the office, you do look just a little bit beat up, but it's not anything that can't.
Should be okay by Thanksgiving.
Oh, Lord, it's a week away.
A question about the Botox.
Ask away.
Okay, suppose you had a patient with, say, slight ptosis of one eye,
Uh-huh.
and a jumpy opposite eye. Would
Okay.
you Botox the jumpy eye?
Sure.
You would.
Yes, ma'am. Because the ptosis is due to an upper eyelid problem, and usually jumpy eyes are due to the spasm of the muscle around the lower part of the eye. You know, down on the cheek and stuff, the twitching of the eye, it's usually the lower muscles, so I wouldn't have any problem with that.
So that doesn't mean there could be more of a complication
That's correct.
of the ptosis.
That's correct.
Opposite eye.
That's correct. That's correct. All right, let's do a little on the other side. Just kind of touch things up, and so we're just softening the folds here. You doing all right? About what you expected? Any other questions I can answer? And Patricia here has never had an injection before, so this is her first time experiencing this in front of all you guys. She's doing great. She's doing great. And that's a syringe of wrestling. And so what I do is I just feel around to make sure that there aren't any nodules in the face that I need to concern myself with. And even with this stuff, if a patient noticed one when they went home later, they could massage it out themselves. Yeah, massage it out yourself. And the key is that it's the nodules that you see that are the problem. If you feel something, that's not a big deal. You just leave that stuff alone, because it's put in that area because you were trying to fill that area, and then it'll settle itself out. So the ones you can't see don't really matter. You don't want to start pushing the product all over God's creation, because the more you spread it around. I'm just feeling around the area, making sure that there aren't any major lumps or bumps that I need to address, and everything feels pretty symmetric to me.
How soon will she see the folds gone? Right away?
So it takes a little bit of time. It's usually about 24 hours before you see the full effect of everything, because you get some swelling from the injection of the needle. And as the needle enters, you're creating a small bruise is really the right term, like a little bit of edema, but it's not necessarily a bruise you see on the outside of the skin.
Okay.
So then everything settles out, and by tomorrow and for the disc port, it'll take about 4 days or so.
So she'll notice that going away from her nose also?
Yeah, you'll notice.
So-
Yep, exactly.
Okay.
So between the Botox and the Restylane that you just did, if she'd had this done, not here, not today, how much would that procedure have cost?
About $1,000 for everything.
Every 6
I
months.
wish I was there.
Another volunteer? He may be here all week. Send over more needles.
Yeah.
All right, I give this, and you're all wrapped up. And I thank you. It's stopping the muscle from moving so much in that area, creating the wrinkles. So let's do a little treatment with some disc port first. Another lovely palette to work with here. All right. So this is just a rinse and repeat, essentially, with the areas that we addressed with the disc port. I probably would not have injected as much into Patricia as I said before she came into my office, because I'm not just trying to take money from folks. You know, I want to do something that I would really think would help them. But since we had the product available and she'll get a nice result from it, why not? So go ahead and furrow your brow for me. There you go. So you can see in Carla a little more pronunciation of what we call the 11s. I'm not going to inject you yet here. So the vertical lines that are located right here between the eyes, and that's really what we're trying to affect a change on with this disc port, which again is a neuromodulator intended to soften the appearance and prevent the muscle from acting up so much. All right, squint like it's bright outside, and you can see these crow's feet that have developed around the sides of the eyes right here. And so again, that's what that's going to soften. And it's not that you only squint when it's bright out. When you're laughing or smiling or carrying on a conversation, oftentimes your eyes will automatically kind of squint. So in those conversations, you'll just have a little bit more of a brighter appearance. Your eye's not going to be so tight and drawn in. All right.
Yeah, was she paid?
No, she left.
All right, turn your head toward me. Okay, furrow your brow. I'm going to get you a stick here in just a second. Relax, you're doing fine. We'll stick right here. All right. You okay?
Okay.
And a little stick. Okay. Yeah, that's the worst part actually. So the area between the eyes I find to be the worst part. Almost uniformly patients are like, yeah, it burns a bit, it stings.
That really wasn't bad.
Even the old Botox pros that come in are like, all right, I'm ready for the bad part.
Yeah,
Hit me
yeah.
between the eyes, and then
Yeah.
and after that, everything's fine. So I like to get that over with. Get well there. Stick around the side of the eye here. You feel free to wince if I'm hurting you. It's going to hurt my feelings. Great. All right, that's the eye on that side, and then we'll do the other side. You doing all right?
I'm done.
Fantastic. Go Duke Raleigh.
We don't do this every day.
What'd you say?
Don't you need another volunteer?
Yeah.
Only after Rusty.
Sure there's a waiting list.
There was a woman here in Raleigh, she died of something, like, they put some kind of treatment in her.
No, it was on her legs. She
Oh,
was
that
having-
girl,
yeah.
a young girl.
That young girl.
Yeah.
Several years
That was
ago.
a numbing cream or
Yeah.
something.
Yeah, she had slathered all over.
Yeah, but
her.
that was her fault.
That's a friend, right?
Yeah, that can cause something called methemoglobinemia,
Yeah.
and
She was in a
the oxygen, the hemoglobin in the cells isn't able to exchange oxygen, and so the patient dies. Okay, just put your forehead down. Raise your eyebrows up. Okay, relax.
She put some stuff and she went to just get laser. Remove a lot of hair and she put too much stuff on her legs and she covered it with plastic. I'm surprised she was a chemistry major, so she should have known better. Mother was a nurse. Father was a PhD. This was like 10 years ago.
You okay?
Son did because like 6 out of the country I came back. That was the funeral.
Nice result from this. All right, well done with that. Back to the old thing. We'll be addressing some of the similar areas that we did on Patricia, trying to get the line, the fold that's developed right here, what I call the labiomandibular fold, coming from the lip, extending down to the jawbone on both sides. She doesn't need as much in her upper folds here. She's got a nice smooth fold there, so we won't be putting much product in that area.
How much do you charge for consultation?
It's a $50 fee. And all my charges are through Duke. Everything's done by Duke.
All your charges are what, sir?
Through Duke, I don't have any of my own individual fees. Everything's done at the discretion of Duke.
What does that mean exactly?
That they control most all of the fees that are associated
okay.
with everything.
Not insurance, you mean?
Correct. Okay. This way just a little bit. And then turn back away this way just a hair. So you can see in her, I think you can see the difference between the sides. If you look right over on this side right here, you can see how things have softened quite a bit, and you can see she still has this fairly deep line located on her other side that hasn't been injected yet. So that's kind of what you can expect from these types of injections. Put a little stick up here. A little on the other side. Feeling okay? All right, nice and relaxed. We're just rolling out the corner of her lip with this injection. You can see we're getting rid of that line that's located on that side.
Much better.
Hey.
You need to see some ID here?
Yes. I hope so.
That's all I need to do for you. Let me just do a little massage and then we're done.
Doctor, you say your consultation is $50?
That's correct.
Now, does that go, if you have a treatment, does that go against?
That's
what does
correct.
that cost?
That's correct.
Okay.
And we have stacks of his business card out on the check-in table.
I see.
And I have stacks of his business cards with me here. There's some out on the check-in table, and I also have some that belongs to his.
How long have you been doing this?
For several years now. About 2.5, about 2 years. Yeah, exactly. This is the second one I'm trying this out.
It's Monday.
You look very young.
Well, thank you. Thank you kindly. It's an honor. Yeah, it's a good question. I see patients both here at Duke Raleigh at the MOB8 building, which is the big Duke building right across the street, or right across this little street out front here. And then I also see folks in Durham at the Aesthetic Center.
Dr. Woodard, how long once a patient calls until they're seen?
It depends on when you want to be seen. I tend to see patients on Tuesdays and Wednesdays and operate most other days of the week. So if it depends on, we can make anything work. If you're having a problem, just call my direct number on the card out there. My secretary will contact me if you're having a problem getting an appointment, and I'll make it happen. Particularly if you've attended this, you know.
What can you do during the downtime? Can you just lie in bed, or can you do anything?
No, I encourage you to be active, out and about, moving around to prevent blood clots or anything. Thank you very much. I appreciate it, Carl.
Absolutely.
On to fillers. Ideal filler. So this is the criteria for an ideal filler. And these are those Restylane, Perlane, that sort of thing. And we'll talk about it here in just a second. It needs to be biocompatible. That means your body's not reacting to it. Non-immunogenic, another word for non-reactivity. You don't want it to cause any inflammation. Obviously, you don't want it to cause cancer. Should either completely go away or you should be able to easily get it out. You should have a predictable result from it. You should be able to adjust it to the patient's anatomy. Not necessarily permanent, and it's got to have a natural appearance. So these are all my criteria for an ideal filler. And I think there are some out there that really work quite well, but it's individualized for each patient. So we'll talk about the different subtypes. Hyaluronic acids are the most common. Restylane, Juvederm, Perlane, and a new one, Bellatero, that just came out. These are the ones that most people have heard of. You see them in the magazines, Southern Living, all the other different magazines advertising what they can do. It's because they have a really good track record. Low side effect profile. Most folks don't have any allergic reaction. I mean, that would be a reportable event. And the volume improvement that you get from these, and these are typically injected in the folds, and I'll show you a few examples of that, but the typical improvement is for 6 months or greater. They are, in fact, reversible, which is the best thing about them. So if you don't like it or you get a little lump or bump that you've noticed, there's actually medication that you can inject and it just completely dissolves it away. The way it works scientifically is hyaluronic acid is a hydrophilic substance. So what does that mean? It draws water into itself, so it allows volume to stay in that area by keeping that part of your tissue very well hydrated. Calcium hydroxylapatite, Radiesse is the brand name for that. That's something that I use for folks in their mid-face area, and I'll show you an example of that as well. It really, for those people who have gotten the atrophy and have gotten the hollowing or skeletonization around their eye, adding some additional volume there so that you take the what I call the aging triangle, or the triangle that has its apex at your nose and comes down like this, and then you reverse it and get that triangle that you had when you were youthful, where the line comes here and the point comes down this way. So you'll see in the injections and in pictures, it helps reframe the face. It's a really nice injection to do. It is a deeper injection down on bone adjacent to the cheek, but it's very well tolerated. Patients with a little topical numbing medicine do just fine with it. Much longer lasting. I think the company says about 18 months. I've seen 2 or 3 years out of the injection. It's really quite nice, and it's used for more significant volume loss. Sculptra I won't spend a lot of time on. I'm not a huge fan. I don't know if anybody here has had any experience with Sculptra. its gimmick is that it helps you stimulate your body's own collagen production. It's more natural. It just takes, a series of 3 or 4 injections and a couple $1,000s to get that result, and patients just don't have the patience to do that. So while it lasts for a really long time, it's not something that I tend to reach for when I'm trying to get things corrected for folks. So nasolabial fold treatment, this is from Restyling's website. You can see a pretty dramatic difference in this individual. Those lines are noticeable around the face, and you can essentially make them either disappear or soften their appearance. And this type of injection takes a couple of minutes to do. There's no downtime associated with it, and you really have I would say a pretty good result. Another example of what we call the nasolabial folds. So what are those again? Those are these cheek folds that develop. And you remember, and I'll show a slide later too, the reason why this fold is developing is because you have loss of volume in this area. That leads to skeletonization or exposure of the bone overlying your cheek, so you lose the volume of your cheek, and then the tissue descends in this direction. So that's how this fold is created as we age. Another individual, really nice result around the lips. Those fine lines that occur around the lips as the lips start to deflate and you lose your volume can really remarkably change with one syringe of this particular product. So it gives her a really nice look. There's not really anything else that she's had done, and you can see a really nice result with one treatment syringe. It's a little sensitive around the lips, but we have some tricks to treat that. So what are the complications? Asymmetry, one side looking different than the other. I always like to tell patients asymmetries that exist before I touch them belong to the patient, but as soon as I put my hands on the patient, I bought the asymmetry. So it becomes my issue. So you need to, nobody, if you split a face left or right, has perfect symmetry between the sides, but if there are some noticeable asymmetries, it's my job to point those out ahead of time so that you see them in the mirror before we get started trying to change things around for you. Infection, extremely low rate of infection, less than 1%. And nodules are really due to an inexperienced injector, somebody who injects the product too superficially. Depending on the product, as I said, there are some things you can do to get rid of that by injecting a different type of product to dissolve it, but you'd just rather not have that problem to begin with. You want it done right the first time around. Cost benefit, about the same as the upper face treatment for the Botox. Depending on the product that's used, 6 months or so for a hyaluronic acid like Restylane, that radius, that deeper injection where we're restoring volume to the mid-face, we're looking at, the manufacturer says about 18 months. I've seen it last much longer than that. So it can give you a really nice benefit. And really there's no downtime. It's sore for a day and that's about it. So laser resurfacing and chemical peels, I lumped them together because they accomplish essentially the same thing. They're both removing layers of the epidermis, which is the outer layer of the skin, and depending on the depth of penetration of either the laser or the chemical peel, they're removing some of those deeper dermal layers. And it's the yin and the yang when you're talking about this, because there's a direct relationship between the depth of penetration and how much you remove and the downtime you have trying to recover from this. So if you're looking for a significant result, then unfortunately you're going to have a significant amount of downtime because you're removing a lot of the layers of the skin, and so the skin has to heal itself. If your tolerance for and when I say downtime, the skin is you look like you've been burned. The face is very red, it's noticeable, and it can last. For superficial things, it can last for a couple of days. For things that extend much deeper, it can be weeks to even months of some level of redness. So if you don't have a tolerance for that from either a social or professional standpoint, then this isn't the type of treatment for you. But this is really what we have available to treat the skin. Surgeons often look at the skin as a vehicle to get through, to do the stuff underneath. But in fact, the skin is what we all see. So I recommend, and I think this is a good time to bring that up, that in anyone who's interested in improving their appearance, the number one things that they can do are good skin care. And finding yourself an esthetician that you trust and can help you with that doesn't sell you like, I don't know, some kind of pig fetus lotion from France that costs $1,000 a bottle because it's the latest and greatest thing, but rather knows how to help you take care of your skin. It really can go miles for you. It can really make a huge difference. So in terms of my skin care, adequate hydration, a good facial moisturizer, and sunscreen. I treat a lot of facial cancers Just reconstructed a guy this morning, in fact, upstairs in the clinic, who had a big hole in the side of his nose from the skin cancer. So, we're seeing more and more of that. So sun protection is essential because the sun is what damages and ages us. It's the one thing that we can control in the aging process. So those three things, again, hydration, a good facial moisturizer, and sunscreen are really the pillars of good skincare. This is the Fitzpatrick classification. This is how us doctors kind of try to objectify and identify and categorize each patient into different scores. And the only reason I put this up is patients who have darker skin really aren't great candidates for having resurfacing procedures done because the risk of pigment changes and scarring is much greater in those individuals. So you have to be mindful of the patient selection that you have. Just another scale, I won't go through it. Again, complications, infection, pretty low rate, but if you're peeling off the layer of the skin, and the skin's what protects our body from the external environment, it makes sense that some people are going to get infections. So you want to protect against that, and there are several different tricks that we use for that. Pigment changes can be really devastating, particularly if you have a full face change. And so in darker skinned individuals, I don't offer these procedures because while you can get rid of the wrinkles, if you take a dark skinned individual and make half their skin look very light, that's fairly bizarre to get rid of the wrinkles. Scarring risk, that is directly proportional to the depth of penetration of the technology that's being used. So if you want to go aggressive, you have to know that your risk of scarring increases fairly significantly. And there is always a risk of herpes in patients who have a history of fever blisters, so we pre-treat with antiviral medications. Cost benefit ranges the whole gamut. If you're talking about a little microdermabrasion by the esthetician, that might cost you $70. If you're talking about peeling the whole face and a lot of downtime, that could be several $1,000s. So the duration effect and downtime, again, are variable based on the depth of penetration, like I've been talking about before. So let's talk about some of the surgical things that I do and that fall into the aging face category. Brow lift, simply just repositioning the eyebrows. The interesting thing about this, I've gone to a lot of meetings recently where some of the world's experts have been talking about this, is we've all come to the conclusion that we've kind of been overlifting brows a little bit. As patients age, the brow certainly does descend somewhat, but if you pull them up real high and give somebody that surprise look, that really isn't facial rejuvenation. That's just another type of bizarre appearance the patient's going to have. They do descend some as we age, but if you put your finger up here and move the tissue over your forehead, it's much less mobile than the tissue along the rest of your face, the jowling area, the neck. So it makes sense that they really don't change that much in position. There is some volume loss of the fat overlying the brow fat pad, which is located right beneath the hair of the brow. And we now think that volume loss has a more significant change in the position of the brow. So this is some of the stuff sort of coming down the pipe. Brow lift also has the ability to smooth out some of the forehead wrinkles, but again, when I say that, there are two different types of wrinkles. They're the type when I'm sitting there and I don't move my face at all that you see on my face, and then they're the wrinkles that I can create by moving things around. The Botox and the Dysport takes care of these kind of wrinkles that I can move my face around and demonstrate. The brow lift takes care of that, the wrinkles or creases in the forehead that are just sitting there when you're sitting there, not animating your face at all. And then the brow really will help reframe the eye. So I'll often have folks come into me and they want eyelid surgery, like, oh, I can't stand all this baggy skin around my eyes. But then when I point out to them in the mirror that their brows have descended and they're sitting below the rim of their orbit, they recognize that repositioning the brow helps give the eye a better appearance. So it's really kind of a twofer to get things the way you want them. So this is an example of an individual who had a brow lift and upper lid blepharoplasty done. And you can see when she's sitting there not animating her face, I would argue she looks kind of angry, just angry or a little bit sad, or just, you might want to go up to the individual and say, are you okay? Something wrong? And that's going to make this patient really upset if they feel totally fine. And maybe she is a little angry that she's got brows that are setting a little low. But if I put my finger up here and feel that brow sits right at the orbital rim, in other words, the bone right at the skull here, the eyebrow sitting right there, and in women, that's a little bit low. You want to position them just a little bit more. So in lifting this brow up, we've taken away some of the extra skin that was kind of hanging down here, but then she also had a blepharoplasty where a little bit of the extra skin was removed. But granted, she is smiling in the second picture, so obviously she looks happy. But if you were to draw a line here and cut all of this out, and you looked at this eye and eyebrow complex, just that, and you looked at this one, you could clearly select the one on the right side of the screen here is the better looking. And it really helps rejuvenate her upper face. So there are a number of different approaches that are used. I tend to use the endoscopic approach, which involves a couple little incisions back in the hairline. They're all hidden, and I use a series of scopes that I project on a video screen and kind of do my procedure underneath the skin. The traditional way was to make an incision from this part of the ear all the way across the head to the other side, and without being too grotesque, essentially peel the forehead down and reposition it and cut the skin out. So mine is, while I'm elevating the same amount of tissue, I'm not exposing or opening up, so the risk of infection is much lower, recovery is much better, risk of hair loss is much lower. So it tends to be my preferred technique for taking care of this issue. And as I said before, often it's done in combination with eyelid surgery. What are the complications? Well, if you lift one brow higher than the other, you're going to have an asymmetric brow. That's pretty uncommon unless there's an asymmetry that exists beforehand, and that again is the patient education you have to do to make sure that they're aware of what they look like before, and if you need to do adjustments for each individual brow, that can be done. Alopecia is just the $5 doctor term for hair loss. In those incisions that went across the entire forehead, that was one of the main complaints of patients, was that they, in the incision line, would often lose a little bit of hair, and that's very important, particularly in women and even in men, because in male pattern balding, if you lift the hair up and they start to lose, they're already losing hair in that area, or the hair is quite thin, that incision is going to show much more. So that's one of the benefits of that endoscopic lift, is it's just not as many incisions. And then nerve injury, the nerve that allows you to elevate your eyebrows up, can be injured in this surgery if it's done more or less by an inexperienced surgeon. So cost benefit, around $5,000 to $6,000 to get everything done. This is not, what I would also point out here though is, this is something sometimes insurance companies do pay for. And it's not because you say, I want to have cosmetic surgery, I want to have my brows lifted, but you can imagine as you age and everything gets so heavy, the brows down, the eyelid skin, you just feel like you can't even open your eyes. And so if an eye doctor does a visual field test and determines that your peripheral vision is significantly affected by how everything's kind of started to droop on your face, then oftentimes the insurance company will sign off and pay for the procedure. So just something to be aware of. I'm not suggesting that everyone run out to their ophthalmologist and have an eye test, but this is something that is occasionally covered by insurance. Permanent's got an asterisk, and that's because while it does create a permanent change, you'll never be exactly like you were right before the procedure. The aging process continues the minute you leave the operating room. So the same factors that were causing you to age continue to occur. There was no medicine or magic dust that was sprinkled on you that prevents that from occurring. So 10, 20 years down the road, you may need an additional procedure to get you back where you want to be again. So it's not the be-all, end-all, but it is something that does affect a significant change that you should expect to last for a significant amount of time. Downtime, 7 to 10 days. Most of my patients I find have a little bit of a headache right after the procedure, because you can imagine it's a little tight on the forehead. Nothing that isn't managed with a little Tylenol or mild narcotic medication. It is a general anesthesia procedure, so sometimes you're also toying with how long it takes you to normally recover from an anesthetic. If you're one of those that gets nauseated and you're nauseated for many days, well, that's factored into that 7 to 10 days of downtime. And after 7 to 10 days, you're very presentable. You have just a little minimal amount of bruising that sometimes will occur, and it is quite mild, well-tolerated procedure. Blepharoplasty is just a fancy word for eyelid surgery, removing the upper skin of the eyelid or the skin of the lower eyelid and fat possibly of the lower eyelid. So as we age, this is just another example of what happens around the eye. You can see that the brow has dropped down just a little bit, but if you compare the pictures, not much. So I think this is a true artistic rendition of what happens when we age. The fat above the eyelid starts to atrophy, so you get this volume loss above the eyelid. You start to get these grooves and folds that tend to develop, and the skeletonization over your cheekbone here. And these are all more or less classic signs of aging around the eye. So what do we do here? In an upper lid blepharoplasty, you've got if you close one eye and kind of look at the other one in the mirror, you've got a little lid crease that's there. Just make an incision in that lid crease, and that we measure and remove the excess skin that's there. It's really a simple procedure. If it's done under a local anesthesia, it can be quite cost saving because you don't have to pay for the anesthesiologist, and it's something that's pretty easy to recover from. Lower lid blepharoplasty, a little more involved because malposition or change in position of the lower lid can cause the lower lid to pull down. So you want to be careful about who you select to do surgery on your lower eyelids especially. The incision is either hidden right below the lash line, or I'll often make an incision by, and again I don't want to be too grotesque, but pulling the eyelid down and making an incision inside the eyelid so the incision is hidden. And then remove fat from the eyelid in that area to kind of take care of the quote bags underneath the eyes. Complications: eyelid malposition, incomplete eye closure. So if too much skin is removed from the upper or lower eyelid, while it'll be nice and smooth and there aren't any wrinkles, if you can't close your eye all the way, that's a big problem. So you have to make sure you find somebody experienced in doing this so that you can avoid some of these complications. Dry eye. In patients who have pre-existing dry eye, you can't be as aggressive surgically because you can make their dry eye much worse. And then there's we quote, based on literature, a 1 in 10,000 risk of vision loss from this type of surgery. That is exceedingly rare, but you are operating around the eye, so you have to understand that does come into play. Cost benefit, same range as approximately what a brow lift would be. Again, insurance does sometimes pay for this if you've got that excess hooding of skin that affects your peripheral vision. The same permanent with an asterisk and similar downtime, just a little bruising around the eyes. Implants, they're often, this is one of the upticks that we're seeing in surgical procedures actually, because they're fairly easy to do and they're used to augment the loss of volume that we see. And as I showed you those pictures of the split face of the facial aging that occurs, a lot of the facial aging has to do with volume loss. So in restoring volume, we're putting in these implants to fix that particular issue. And they can be what's called an alloplastic implant, which is essentially just an implant made of something that's not made of you. And in many cases, it's silicone or Gore-Tex. And then we often will use fat as well, so borrow fat from another area on your body and then inject that. The problem with fat in some instances is that it's difficult to predict how much of that fat will stay. So if you're using a large volume of fat, you may have some asymmetries from one side or the other that the implants don't cause a problem with. So this is an example of a lady with a chin implant, and you can see, she may have come in for a question of doing a rhinoplasty, but she doesn't have a big nose. The problem is she's got a small chin. So you put a little chin implant in and it makes her profile look so much better. Gentleman that comes in complaining of looking tired, really tired of being told that when he feels perfectly fine, just has significant volume loss in his mid-face, and so a couple of facial implants fixes him. Costs for implants, somewhere it really does depend if we're using fat versus using one of the plastic implants, but a couple of $1,000s for a procedure like that. And the risks, if you're using one of those plastic or non-U implants, the risks are that those implants can get infected. So it's very important that doc treats you with an appropriate course of antibiotics following treatment for any of those type of implants. So now we're on to talk about facelifting. And this word means different things to different individuals. You're like, facelift, this is my face, what are you lifting? And we've talked about a bunch of different procedures. A facelift really is intended to address the lower third of the face, so below the area of the nose and the neck. So for folks who have a lot of neck laxity, the jowling that starts to develop, you're an ideal candidate for a facelift. But that's all that it's going to address. So if you come in and say, Doc, I want a facelift, because I've got that, but my eyes are bothering me. Well, that's a different procedure. You're going to be talking about doing perhaps a couple of things. So facelift doesn't mean taking care of the entire face. And this is what I mean by that slide. So this is the mid-face region that I've been talking about throughout the entire talk, where you have this volume loss over here and descent of tissue creating this fold. A facelift itself really doesn't take care of that issue. This is I know it's all semantics, but this would be a mid-face lift, so lifting specifically the mid-face area. So if you come in and you've got a lot of volume loss right here, we can either non-surgically with those injections like Radiesse fill that area and give you that mid-face lift, or surgically lift the mid-face, and if you're fine along the jawline here, that's all you need. If you've got this neck laxity that started to develop as you've aged, and these jowls that have started to develop, that's more addressed with a facelift. So what are some of the complications of a facelift? the main complication is a hematoma, and there's about a 5 to 10% risk of having a small hematoma. But I put in drains behind my facelift patients, and often when they come back their first day after surgery, there's a little, it's about a cc, so a couple of drops of blood that I'll just drain right around the drain site, and that's pretty normal. That's not really a hematoma. Hematoma is something where a big blood collection occurs below the skin, and you got to take the patient back to the operating room, or else the skin in that area is going to die, and that risk is much lower. There is a risk of infection, and it all is predicated on how sterile the operation itself is. Asymmetry is not really a significant risk. You would think that it might be, but when you're pulling the skin and redraping it, it drapes itself quite uniformly across the entire face. The feared one is facial nerve injury, and so there's a less than 1% risk chance of a facial nerve injury, and that's the facial nerve comes out right below your ear right here at the skull base, and it sends out 5 branches across your face, and each branch is responsible for helping you move that side of your face. As the flap is lifted, the dissection plane is right above that nerve, and if somebody is inexperienced or if somebody is aggressive, that nerve can either be temporarily injured or it can be permanently injured. And how would that manifest itself? Well, if you're dissecting out, the most common branch that's injured is the one that comes down around and allows you to smile, and you would have an asymmetric smile as a result of the injury to that nerve that could be, again, temporary or permanent. So it's something to consider if you're looking to move forward with the procedure. And then under or over correction. Historically, overcorrection was a problem because we didn't really understand the anatomy of the face. So facelift done back in the 60s and 70s was make incisions in front of the ear back into the hairline, essentially put your foot on the patient's head and pull the skin as tight as you possibly can, cut away the excess and sew it in. And so the patients looked like they had been standing in front of a fan and their face was blown completely back. And while everything was tight and held up, it looked weird, it just didn't look like that doesn't look refreshed or rejuvenated to me. It looks like somebody just really pulled your skin back tightly. What we now understand is that there's tissue underneath the layer of the skin, and that tissue is connected to all the facial muscles, and that's the ticket. That's the tissue that you need to reposition. And so you don't have to really pull on the skin at all. You actually cut away very little excess skin in a facelift. It's surprising. Even patients with a lot of laxity, because you're repositioning that band of tissue below the skin that supports all of the muscles, and that gets the job done. Cost benefit, depending on the extent of what needs to be done, this is the typical cost you can expect. Again, permanent with an asterisk. And downtime really is dependent. There are different flavors of facelift. If you go online and type in facelift, every doctor in the country is named one after themselves. So there are hundreds. There are literally hundreds, and there may be even 1,000 different variations on a facelift. So it depends on what you want done. If you're looking for a little bit of downtime and just want a little tuck-up procedure, that's pretty easy to accomplish and it'll be much less expensive. If you're looking for the full Monty, you need to expect that you're going to have some bruising for a couple of weeks and you're not going to be presentable. So, I wouldn't do a facelift on somebody tomorrow that wanted to look like, I wouldn't do the full facelift on someone tomorrow who wants at Thanksgiving time to be perfectly presentable for the family, because it's not a realistic expectation. But if you need a little tuck up, that's something that's easy to accomplish. So, in summary, there really are a myriad of facial aesthetic procedures available. As you guys can see, we went through a whole bunch of stuff, and really the goal of this talk was just to make you aware of what's out there, kind of educate you on that. You got to select the correct procedure for the correct patient. That's how, if the surgeon's goals and the patient's goals are congruent, you can expect that you're going to have a successful outcome, and that's really the goal. Restore, refresh, and rejuvenate, and I do believe beauty is truly in the eye of the beholder. And with that, I will thank you. I think everything